Hi there. Are you caring for someone with delirium? This video will help you support your loved one, both in and out of hospital, and help manage any stress you might feel. Let's start with some info on delirium. Delirium is a sudden change in a person's thinking and behavior, which makes them confused and act differently to their normal selves. 3 in 10 elderly people have delirium in hospital, but it can also be experienced by those that are very sick, taking multiple medications, have an alcohol or drug reliance, or had recent surgery, head injury, or stroke. So, how can you tell if your loved one has delirium? Well, they might appear confused and forgetful, lack concentration, and not seem their normal self. They might also have a change in appetite, find it hard to control their bladder or bowel, see and hear things that aren't there, or have trouble sleeping. They may also have changes in their mood, becoming easily upset and restless, or on the other hand, quiet and sluggish, or even a mix of both. These symptoms can develop quickly and come and go throughout the day. While delirium usually lasts for only a few days, it can sometimes continue for weeks or even months. If you notice any symptoms, you should immediately tell a healthcare professional, like a doctor or nurse from your local GP or hospital. Finding delirium early can prevent problems like falls, poor nutrition, bed sores, and a longer stay in hospital. On this website is a simple questionnaire to help identify delirium in your loved one. It is found in the Delirium Toolkit. It needs no medical training and is completed by answering yes or no to just 7 questions. Here's how it works. Each time you answer yes to a question, you simply add the number in the yes box to your total score. After all the questions have been answered, a total score of 4 or more means your loved one might have delirium, and you should contact a healthcare professional for further advice. The test can be used anytime your loved one is showing signs of delirium, in and out of hospital. Let's look at an example of delirium. This is James. James is 70 years old and has just had surgery after a fall down some stairs. He has awoken in hospital with a fever and is clearly in a lot of pain. James is not his usual self. He is confused and does not know where he is or who the loved ones surrounding him are. He is also complaining about seeing strange figures that nobody else can see. These hallucinations are making him very anxious and afraid. You can help your loved one feel more settled while in hospital. Visit often and bring along some of their favorite things from home, such as personal photos, music, or books. Making the environment familiar will remind them of home and help them settle. Offer assistance and help them with eating and drinking, or even taking a walk. Oh, and don't forget to provide their glasses, hearing aids, false teeth, or walking aids. Your loved one may be feeling lost and confused, so remember to be patient, speak calmly and slowly, and help them identify the things around them and why they are in hospital. Before leaving hospital, a healthcare professional will talk to you about the ongoing care your loved one may need. This is known as a care plan. The care plan helps manage your loved one's condition at home, so they are less likely to have delirium again. It might include instructions about diet and medication and information about support services that can help from home. Caring for someone with delirium can be stressful, and it is important to access support when you need it. Carer Gateway is an Australian government program that will provide you with support services such as free counselling, training, and financial support. You can visit them at carergateway.gov.au or phone them on 1800 422 737. Okay, let's end with a quick recap of the video. Make sure to contact a healthcare professional if you notice signs of delirium in your loved one. The earlier, the better. Use the test shown in this video. It is a simple and effective way to quickly check for delirium. Help your loved one during their stay in hospital. Be there for them and recreate a familiar environment with objects from home. Follow the care plan made for your loved one. It will guide you and your loved one after hospital. And finally, remember to take care of yourself and reach out for professional help when you need it.